So this is the new kit on the tech. I found it very good. This is how the engine looks like. It is a negative pressure, almost 30 atm, and it is the continuous negative pressure. Whereas we suck with the syringe, when some fluid comes in the syringe, the pressure drops down, so we cannot maintain that. And innovative thing is that we have to go to the proximal segment, and this is how engine is there. You put the catheter, connect the catheter. Once the engine is ready, you make the switch on, and then it sucks this thing. As far as the trials are concerned, there are no many trials supporting the thrombus suction. Still, it hasn't come to the class 1 indication, but many times we know it is thrombus, and it really helps in our practical this thing. Initially, I use this thrombus suction because it gives sustained suction. The ease it goes below the line is very good. Many times we find difficult in where this guy is going to be. So this Pumra engine, this is associated with the Sejanan. So you can catch up the Sejanan guy and tell them to get this machine, and looks very promising. I have treated initially pulmonembolism massive, like we tried with thrombolytic therapy. You can see this particular diverter which can break the thrombus there. Unfortunately, I had no chance to use it because it was not available. But in pulmonary embolism cases, you can easily go into pulmonary arteries. We go by CT scan, and if we are sure, many times we go like this is the massive thrombus you can see on left pulmonary artery. And the catheter is quite malleable. It is very soft, doesn't harm. And you can see it, I have passed in multiple directions. It has got a little bent, and it can very good give thrombus suction. And you can see this has all cleared basically, and multiple runs on multiple branches. Obviously, you can manipulate with a JR or multi-purpose, and you can enter multiple branches. After doing this, I had a chance whereby patient had a MCA infarct. Unfortunately, neurointerventionists were not available. Neuroradiologists were not available. I used this engine on the middle cerebral artery. With little manipulation, of course, we as a cardiologist, we have to learn how to manipulate in the cerebral arteries. They are very delicate. We cannot go very fast. We have to be very slow. Obviously, our technicians are there to hold us back. But this, even with this machine, I could do the mechanical thrombectomy of the middle cellular artery very successfully. Very soft catheter. So probably we can learn when young individual with multiple thrombus burden, we can see. We do give Brilinta, we give the 2B3 inhibitors, but this thrombus suction looks very promising because it is very smooth. New thing it has taught me is go from proximal to distal, and runs are very smooth. You keep it very nice, clean, so you can reuse very smoothly. So looks a good kit on the block. Thank you.